Hello everyone, today we will discuss a very important clinical topic, approach to a patient with arthritis. This is a very common problem we see in day-to-day practice, and the systematic approach helps us arrive at a right diagnosis quickly. Understanding the musculoskeletal system. Arthritis basically is inflammation of the joint. The musculoskeletal system is made up of muscles, tendons, bones, periosteum, joints, ligaments, capsules, and the surrounding soft tissue. When we say arthritis, we are talking specifically about the joint. Important definitions: arthritis is pain plus inflammation, and arthralgia is just the plain pain, no inflammation. There is one more term, enthesitis, that is inflammation of the tendon, ligaments, and capsule, insertion into the bone. Now, during history taking, when you approach a patient, always start with the history, ask about onset and duration, whether it is acute or chronic, whether the patient has any morning stiffness, whether it is inflammatory like it happens in rheumatoid arthritis, whether big joints involved or small joints, one joint, two joints, or more joints, mono, oligo, or poly, whether it is axial or appendicular, and whether it is symmetrical, which is typically seen in rheumatoid arthritis, and whether a patient has any systemic features like fever, rash, ulcer, redness of the eyes, or any family history. Now, differential diagnosis: arthritis can be because of n number of reasons. First is inflammatory arthritis, non-inflammatory arthritis. Inflammatory arthritis, rheumatoid arthritis, SLE, ankylosing spondylitis, psoriatic arthritis, and reactive arthritis. Non-inflammatory is osteoarthritis. And we have crystal arthropathies, that is gout, pseudo-gout, and calcium oxalate crystals. And we have infective arthritis, septic arthritis, or tubercular arthritis, and other forms like Charcot joints, trauma, and hemophilia. Now, during examination, we have to be very systemic. In inspection, see how many joints are involved, whether there is any swelling, redness, whether there is muscle wasting, whether there are any skin changes, whether there is any deformity. In palpation, check for the swelling, whether it is bony or soft. Check for the signs of inflammation, tenderness, temperature, muscle power, grip strength, and then the active and the passive movements. Note for any crepitus or restriction. Measurements: check the circumference of the limb, chest expansion, and the Schober's test, which is done for the spine. Special examination of the hand: when you check for the hand, and depending upon which joints are involved, distal interphalangeal joint, proximal interphalangeal, you can diagnose. Now, proximal interphalangeal joint, rheumatoid arthritis; metacarpophalangeal joints, rheumatoid arthritis, SLE; hemochromatosis, pseudo-gout; wrist carpal tunnel syndrome, juvenile arthritis. And then you have crystal arthropathies, gouts, pseudo-gout, and calcium oxalate crystals, and based on the crystals, we can differentiate. Now, in summary, when approaching a patient with arthritis, start with a good history, see how is the onset, acute or chronic, whether the patient has any stiffness, how is the joint pattern, do careful examination, inspection, palpation, movements, and measurement. Look for any systemic features. Keep differentials in mind, whether it is inflammatory, non-inflammatory, infective, or crystal arthropathy. A structured approach ensures you don't miss important causes and helps in targeted management. Now, this was the quick overview of how to approach a patient with arthritis. In next session, we'll discuss each arthritis type in detail with a diagnostic workup and management protocols. Thank you so much.